Federal Drive is presented by GEHA, Government Employees Health Association, proudly providing health and dental benefits to federal employees and their families. Visit GEHA.com.
A new survey finds that nearly every service member living in privatized military housing has experienced serious problems in their home, and many of those issues go unresolved. The Change the Air Foundation recently launched the Safe Military Housing Survey, one of the most comprehensive efforts yet to collect data the Defense Department has never been able to track accurately. The nonprofit found that 3/4 of respondents were dealing with mold and microbial growth, which is extremely hazardous to someone's health. For more, Federal News Network's Anastasia Obis spoke with Erica Thompson, a military spouse and the military families liaison for the Change the Air Foundation, and Brandon Chappo, Director of Public Policy at the Foundation.
Just to give a little bit of back context, Change the Air Foundation, we are a 501c3 nonprofit. We help families breathe safe indoor air and live in healthier homes. We focus on indoor air quality. A big component of indoor air quality and public health are water damaged buildings and mold. And Erica was passed over to us by another nonprofit organization in the space who said she and her family were really affected. She was an absolute warrior trying to get the word out, trying to be the voice and fighting for other families that were impacted by this. And so when we heard her story, we wanted to jump in and try to help because we were mostly focused on the civilian side of this, on the residential side of this, which is rampant, right? There's at least 50% of every home and building in the United States has some level of mold and water damage. So when we were hearing about the rates of exposure and the health impacts for our service members and their families, we were dismayed, we were alarmed, and we wanted to try to help. So this survey came as a result of trying to answer questions that hadn't been answered in previous surveys before, which were really important because we think that they were going to be able to better help Congress and help folks even at the Pentagon pinpoint areas that they needed to try to improve to help these families. So a couple of those aspects were, which Erica can speak a little bit more to, was the health implications, right? So we were hearing a lot of how many indoor air quality hazards and just housing hazards that these families were experiencing, but nobody was really ever asking, how is this affecting your physical health? How is this affecting your cognitive abilities? How is this affecting your mental and emotional health and your personal finances? And so that's a huge component of this survey, was able to get into that, which we were finding some incredibly dismaying numbers, right? I mean, we're seeing in the 40 percentile and 30 percentile of the participants, active service members, dealing with headaches and migraines and fatigue and brain fog and cognitive issues, various other issues within the household as well. So we thought that was incredibly important to cover for folks at the Pentagon and people in Congress who were asking us to do this survey. And then the other was trying to figure out where the gaps were in the current dispute resolution process, which is a 3-step process that was put together to try to give an off-ramp and a fair system to service members and their families to try to get these housing issues dealt with correctly. And I'll let Erica jump in here on that. But what we found confirmed our worst fears, which is that dispute resolution process is failing and isn't working.
And Erica, you and I previously spoke about your experiences. Could you one more time talk about those and how you got involved?
Sure. So we moved into military housing, and we just lived in military housing for 10 months. But as soon as we moved in, we noticed some issues with the home, the AC being one of them. And they said, look, we can't afford to replace your AC. So we did some things to try and mitigate the issues with humidity in the home. We had spent upwards of $6,000 trying to do those things. So dehumidifiers, we had 5 in our house. We bought pure air purifiers. We did as much as we could, and we waited for service calls to be done. And then they came and opened walls in our home. After about 6 months, they came to repair some of those issues. And we were seeing symptoms like crazy throughout our whole family, including our family dog. So he started having seizures, the dog, he was only 4, and he had great labs and he was in great health when we moved into the house. And then our son started passing out in the house, and it was within the same time period. And they opened the walls without any sort of containment or protection. And we saw an influx of medical issues after that point. And so 3 of the kids were diagnosed with asthma. 1 was diagnosed with bilateral pediatric cataracts in both eyes. So we had retina scans done before they opened the walls, and then after because he was passing out. And so he was also diagnosed with POTS. And so he's been passing out and having those episodes and just dysregulation with the nervous system. So we saw a huge range of health implications across the board throughout our whole family. And so I think using part of that, it was able to guide us through this questionnaire. Some of those things that I wish offices knew was able to really give me insight into making some of these questions, because we would share our story with congressional offices and they would say, how many more kids are there like yours? And I said, I don't know. There's no data around that right now. And so that was one of the main drivers we wanted to see how the kids were impacted, how the pets were impacted. You'll see there's even tracking for pet illness on here. And so that was really important because those offices wanted to know. And I think going through that personally, we were able to have sort of that insight as to some of those gaps and then what we'd like, to be able to share and highlight with other offices.
We'll get to those health implications in a little bit, but let's talk about the findings. The report says that nearly every service member living in a privatized military housing has experienced serious problems in their homes. 3/4, that is 78% of respondents, said that their family's health has been negatively impacted by their housing conditions, and nearly half said that medical provider had confirmed that connection. What are the top issues that emerged from the study? What else did you find, and what does it tell us about the privatized housing model?
Out of a lot of the housing issues that we were asking about, mold, mildew, and microbial growth topped the list of hazards at 74%. So 3/4, essentially, of all of the participants were dealing with mold and microbial growth, which, of course, mold and water damage can be extraordinarily hazardous to somebody's health. I myself lived through that a number of years ago. That's what kind of got me involved in the nonprofit and advocating, because I just knew how terrible that the health effects of that were. So that's extremely dismaying. Temperature and humidity issues were found in over 50% of the homes. Pest infestations, water damage again. HVAC issues were over 50%. Poor indoor air quality. So just the list goes on. And what we found was that, I think you mentioned 75 or 76% of the families had health conditions related to the housing, which half of those were confirmed by a physician. Here's the other really alarming stat. 47%, so almost half of the service members, active duty, right, who are out flying our jets, working on, the mechanics, out on the ground, out in the field, they said that their housing issues were causing them to be less mission ready, and it affected their ability to perform their duties. That is absolutely stunning. And so if anything underscores the importance of trying to get these issues dealt with, which of course we're trying to work on some solutions for that right now and putting those forward, it's the fact that, not only are our service members' health and wellness being affected, mission readiness, this is a national security issue, and we need to start talking about it in that light and start really framing it in that way, because it's that important. I mean, no military family should get sick just because they've decided to sacrifice and serve our country. And that's why we're trying to get this information out there and try to work on the solutions.
I think another key point too, Anastasia, is when we asked about readiness, we dove into the specifics. Where do you feel like it's impacting your readiness? And over 61% of the service members said mental health impact. And so that's cognitive, that's depression, anxiety. And when we talk about the mental health of service members, that's a really important issue when they're in the service as well as when they leave. And so I think that's another alarming statistic that we need to dive a little bit more into as well.
Let's talk a little bit more about those health implications. What types of health issues did you find most prevalent? You also have a frequency of experienced health conditions by state. Could you highlight a couple of findings there?
Topping the list of the health findings were anxiety and mood changes, so a lot of emotional and mental and cognitive issues, insomnia, sleep disorders, headaches and migraines, brain fog, skin and eye and respiratory irritations, chronic fatigue, depression. I mean, and these weren't just in the low percentages. We're talking in the 20, 30, 40 percentages for some of these. So, which is extraordinary. I think that, and again, the list was a lot more extensive and expansive than that, but I just think just even those alone being as high as they are really should catch the attention of hopefully the country and, of course, those in Congress.
That's Change the Air Foundation's Brandon Chappo and Erica Thompson, the military families liaison for the foundation, speaking with Federal News Network's Anastasia Obis. You can find her story at federalnewsnetwork.com.